This is Dr. Robert Troell at Beauty by Design. After we do breast augmentation or augmentation and breast lift, also called a mastopexy, there's certain things that you should not do and certain things that you should do after the procedure. One is to decrease your physical activity for the first 4 to 5 weeks. The more you move around, if we have an implant in place, it can actually move the position of the implant, and we don't want to displace that. It takes about 4 to 5 weeks to start to get a capsule, which is a scar tissue around the entire implant, and then that proceeds to about 3 or 4 months to get a more robust capsule. So we don't want that to move. If we use a acellular dermal matrix or monofilament scaffold, it is basically an extra piece of tissue that's keeping your implant in place or adding thickness to your breast. We don't want that to tear and have an increased risk of getting a fluid collection around it called a seroma. So the other thing that almost all patients we want to do continuously for the first month is to use a support bra. Okay, for the first 2 weeks after that, we have a elastic wrap to your breast or a Velcro compression garment that also puts compression to your breast. Those are designed to decrease the risk of a fluid collection and or hematoma. Plus, it can support the breast while the capsule is forming so the breast doesn't get displaced. So direct external compression is essential after this procedure. Additionally, when we're done, we usually have a clear dressing called a Tegaderm dressing on, and when that falls off when you're showering, you can just take it off. Underneath that, right on the wound, is what we call steri-strips. They're like band-aids across the wound. 1, decreases the risk of getting an infection. 2, increases the support of the incision so it heals the best. So we want you to, after the steri-strips fall off, which is classically 2 weeks, or after the surgeon removes them, we'll have you put antibiotic ointment for another week or so until you get full closure. We don't want you to swim in a body of water. You can shower, but no swimming in a lake, a pool, a jacuzzi, or a bathtub for at least 4 weeks. It takes that long for the incision to be completely closed, so there's no risk of getting an infection or contamination. So those are the most important things to do after either a breast augmentation or a augmentation mastopexy or breast lift.